Dr. Irizarry, who is with the University of Illinois Springfield, and we wanted to collaborate. Our two schools are kind of coming together to talk about the practice side, our community health workers, our therapists in the community, all of our community-based programs, and then how that intersects with UIS and with their research efforts and how those two things can kind of work together. We also have Dr. Yarnell, who's one of the administrators, and he should be here soon. So what I was thinking is, oh, hi, Matt's here. I know that Dr. Yarnell and Areli and Chantel and Dr. Irizarry all have wonderful things about themselves. And rather than me try to piece together introductions, I'd love us to just each share just a little bit about who we are and what we do. So my brief introduction would be, I'm the director of the Survivor Recovery Center at SIU School of Medicine. I'm also the director of community health. We're trying to expand our community health programming and family medicine across our federally qualified health center sites. We have 12 sites, and we really want access to community health workers for all of those sites. So I'm kind of a half administrator, half therapist, so I can kind of speak to both today a little bit. How about Areli? Areli, I think you're not, we can't hear you, but you're not muted, I don't think.
She's not muted, but we can't hear her.
Okay, well, Areli figures it out. Let's go to Chantel.
Hi, can you hear me okay?
Yes, ma'am.
Okay, hi, my name is Chantel Bowen. I am a community health worker program service specialist with SIU School of Medicine, working through the Office of Community Care.
Thank you. Areli, were you able to get that fixed up? No. That's okay, Areli, keep trying. Dr. Yarnell, do you want to go ahead and introduce yourself?
Sure, thank you. I'm Matt Yarnell. I'm the director of the Office of Community Care. Our office oversees about 19 funded programs through grants and contracts through federal, state, and local funding, primarily to provide service to underserved, underrepresented communities. But additionally, we have programs that focus on juvenile justice and mitigation of radon and things like that for primarily underserved communities. We also have a nurse family partnership program out of this office, which is wonderful. And I work very closely with Chantel and Areli and Meghan, although her program is separate from ours. It is in the same physical space, so we enjoy each other's company quite often.
Awesome, thanks, Matt. And Dr. Irizarry, can introduce yourself.
Hi, so my name is José Irizarry. I am an assistant professor at the School of Public Management and Policy at the University of Illinois Springfield. I am currently serving as your conference co-chair this year, so I'm exhausted. But that said, let me know if I can be of assistance. I hope you're having a great conference experience, and I'm very, very excited about this panel. Before we start, I just want to make a shout out. I see some students in the room. I see Dr. Hilary Nepper here, who is the editor-in-chief of the Journal of Health and Human Services, I believe. So we have a really, really nice crowd.
Awesome. We'll keep waiting for Areli to jump back on, but as we are, my name is Bonnie Landwehr. I am a licensed clinical social worker, and I also have my master's in public nonprofit administration as well. And I'll just be assisting hosting this area. All right, so just to get started talking a little bit about the community service perspective that we have here with SIU. Chantel, can you talk a little bit about the community health worker's role?
Yes, the community health worker role is to basically promote healthy behavior, help educate and navigate our patients, clients to help with educating them about their medication, helping them with doctor's appointments, also to help them just basically stay out of going to the emergency room all the time. That's one of our biggest goals. So if they're having difficulty managing their medication, we can also try to step in and help them with that. That's one of the things to help them stay out of the emergency room. And I also, being a community health worker, it's also helping them access community resources, not just us, but we are like a network of other resources. We have United Way, we have access to healthcare. So we are trying to also use those other resources to help us in our community role and network role.
Awesome. So you've put in a lot of work trying to engage the community in this. What kind of things do you do to engage them in their healthcare?
So some things sometimes we attend events. Basically, sometimes we get tasks from the doctors to check on certain clients that they might need help with, with different things. We have, in our office, we kind of have different grants that sometimes our clients are actually referred to us that may be dealing with mental health issues, homelessness. There's a wide gamut of what they could be needing help with. So we also try to, or need counseling. And so we try to, once again, bring those resources or let them know what resources are available to them. So when you talk to engagement, once again, we participate in different activities in the community and different community events. And we try to get our name out there to different resources that we're available for services.
Awesome, thanks. I see Areli's popped back up on here. Did we get your speaker fixed at all, Areli? I know Chantel's doing a wonderful job representing community health here.
We're working on it now.
Gotcha, wonderful. All right. So tell me, Chantel, why is it important to meet people where they are when you're seeing them in their homes, in their neighborhoods, you're meeting them at the health fair, rather than just kind of wait for them to come to the doctor?
It's very important to meet them where they are so that they know that I'm not the bad guy. I'm not the person that has basically, if they've come into bad contact with the dentist, or if they've had a bad experience with any facet of healthcare, I'm just there in their community to let them know that I'm not the bad guy. I'm here to kind of help you through those things, some type of fears that you may have, because guess what? I may have had those same fears also. So it's important to kind of, in each community, to have somebody there that you kind of help with building trust.
So it sounds like from what you're saying, we're starting from where they are and we're helping build their confidence and build their own self-sufficiency.
Definitely.
Examples of times that you've helped them build that self-sufficiency and move forward?
So one client in particular, big success story for me. I'm still working with her to this day. I met her at a really low point in her life. She had been suffering from some medical illnesses, had been in the nursing home. She's needed a wheelchair ramp to even get in and out of the house. I was able to help her secure services to provide a wheelchair ramp. We are working on getting her bathrooms redone. So, that's one of the bigger successes of somebody actually trusting me, because when I first met her, she didn't, even believe that I worked for SIU, so, and she would only really talk to me through the Ring doorbell because, COVID was going on. So, that's just one story. I mean, I've been able to get into, help people trust me enough that if I say I'm going to send them to a reputable resource, that they are able to get the help that they need.
Wow. So much groundwork and rapport building goes in just to get started. That's a lot of dedication for you. Can you tell me, what do you love about this work?
What I love is actually seeing some results. Sometimes it takes time. You have to circle back, maybe ask different agencies, sometimes sometimes they're out of money. So you have to like kind of be tenacious and kind of worrisome sometimes with asking for things. But you do, when they do have money available, they will try to help. So that's what I like to see. I like to know that my clients are able to be self-sufficient with maybe with some of the aids that are given to them. Like I said, with the wheelchair ramp, with the new bathroom, that they're able to be more self-sufficient, take care of themselves, not to have so many different people in and out of their home. That's important. Those type of things.
Awesome. Thank you for sharing. Dr. Golden, Dr. Yarnell, I know you've had the opportunity to supervise the amazing Chantel and Areli and be able to work through this. And Dr. Golden, you also had worked in community health as well. Tell me a little bit about your administrative perspective on this. Is healthcare set up to help people with these complex issues?
I can start, or no, you go first. You go ahead.
Sure. I think it's a great question. I don't think traditionally they were. I don't think healthcare, healthcare has always been very episodic and a very reactive industry. And so community health workers, along with ambulatory services, are trying to be more proactive and keep people out of the hospital, prevent people from mismanaging diagnoses. And Chantel does such a wonderful job, and I'm so glad that she was able to join and share some of her stories, because the people that she works with rely on her, and as she said, she's built that trust with them, and it's so important, especially to traditionally underserved and marginalized communities. It's so important that they have someone that they can trust in the community. And so Chantel does such a fantastic job. Areli too. I hope Areli's microphone gets fixed so she can share some of her. You're fixed? Okay, perfect. So she can share some of her stories. But as healthcare continues to evolve, I think the role of community health workers is going to continue to expand and grow. And I see this as really one of the ways that we're going to manage health and community resources going forward into the future.
Absolutely. I like that you pointed out healthcare has always been reactive, and it's so innovative that we're being proactive in this and not letting these folks fall through the gaps here. Dr. Golden, can you tell me what are some of those major gaps in engaging the marginalized communities and those that are oppressed and getting them into healthcare?
I definitely want to do that. That's a great question. I have some thoughts, but I think Areli is good now.
Yep,
Dr. has already chatted me. So yeah, let's hear a little. Areli, you heard the questions about community health work. Can we just get a sense from you about what your role means to you, and maybe any patient stories you can share with us about how you've been able to partner with people in the community?
Yeah, so right now my primary role is to work with the Hispanic and Latinx community, especially those who are undocumented. So recently in the month of May, I was able to help at least 3 to 4 people who are either undocumented or documented immigrants get health insurance. Which is such a big deal, especially for one of my clients who was recently diagnosed with leukemia. So finding health insurance for him was especially grave. And for his mother-in-law as well, I was able to help her get health insurance, which only recently was this able to be possible because Medicaid extended health insurance for people who are seniors who meet a certain age criteria. So I believe it's like 55 and above who are undocumented or documented immigrants get health insurance. So through this program, I was able to get them the help that they need. And for another one of my clients, actually, she was a Mandarin Chinese speaker. And so I don't speak Mandarin Chinese. I speak English and Spanish. So it's a little bit difficult to navigate with that. But thankfully, the marketplace, which is where we went through to get health insurance for her, they had their own translator. So it was kind of like a smooth process. And from there, we were able to find health insurance that was affordable for her. And so doing all of that, being able to do that for them was something that was very special to me, because having health insurance is, something that's very important, especially for those who, are undocumented or unable to afford it. Especially as someone from the Hispanic and Latinx community as well, being able to help my own community and being able to represent my community in this role is something that's very important to me.
Awesome. And building trust, especially with the undocumented community, it's just imperative. Can you tell me what you do to help build that trust with your clients?
Yeah, well, like I mentioned, I think, when you look at me, I think that it's pretty clear that I'm a person of color, and sometimes that I like to disclose where my parents are from and what my history is. So I think self-disclosure is one of the things that helps us to build trust with our clients. So talking to them a little bit about my own history and who are undocumented, I think that helps, and it helps to normalize it as well. And then they feel, okay with talking to me about, their own experiences. I also think that, modeling is an important thing too. So being able to model the things that I want my clients to know. So like if, advocacy is one of those things, right? So for example, in one of the cases where I was trying to help the mother-in-law find health insurance, we could not verify her identity online. So I called a different number and I'm like, hey, we're having this issue, and there was just no help. They couldn't help us. So I'm like, you know what, we're not going to stop here. We're going to go in person and figure it out. And when we went into the DHS office, they were able to help us and figure it out. And in doing so, we were also able to form a relationship with someone else at the DHS office who was also a Spanish connections to kind of help, but teaching them how to advocate for themselves when they need something too. So being able to model and self-disclose, I think, and normalizing helps to.
Awesome. Can you tell me a little bit what some of the challenges are that you experience as a community health worker?
Well, I would say that at first I didn't really know how to help people who were undocumented find health insurance. So finding some resources at first and learning how to navigate that was a little difficult. But after a while, after doing it myself and doing my research and reaching out to other people and other resources, I was able to feel confident enough to actually meet with these clients and to help them. So yeah.
Awesome. Thanks so much for sharing. I'm so happy we got your sound on so we can hear from you. We're going to flip back a little bit to Dr. Golden and talking about those gaps. I know that Areli touched on those gaps as well. What are some of the major gaps that you've noticed for our patients and clients that are traditionally marginalized or oppressed for healthcare?
I think sometimes what tends to happen is there's not always a gap in reaching kind of the middle. I went to another conference and they talked about the middle 80. There's 20% here that have a super easy time getting to the healthcare system. There's 20% here that have so much chaos and inequity and lack of access and trauma history and structural racism and enter gap here that make it difficult for them to engage with healthcare. But then the middle 80 can get in, they can get what they need. And our healthcare system is really built for that middle 40, I would say. So the people on the edge don't really get what they need. So we at SIU, we kind of focus on that 20% over here that really can't get into healthcare. And some people call it hot spotting, where you kind of find the hot spots in the community that need extra help getting in. And I think that's part of what Dr. Yarnell's office does. Some of their funding is based on neighborhoods that really are blighted, that have horrible access to healthcare and almost no business infrastructure. So I think one of the gaps in the healthcare system, from what I've learned, is that not a lot of health systems and programs build programs for that 20% over here. Like the healthiest 20%, there's programs to help them get even better and healthier. The middle 80 are fine. I think my math is off, but like the extremes are really rough. Like the middle people can get what they need. and the people that are the healthiest can get healthier. But I don't like to say the bottom, I'll say the most extreme kind of group. I think I've witnessed in other, not with SIU, but with other employers, that there's not even an effort to reach some of the people that are the most ill, that have the most serious, complex trauma, mental illness, and chronic medical issues, the most extreme poverty, those who are not documented. I've been in other agencies where there's not even an attempt because the funding structures don't work well with them. Home visits are hard to get payment for. Luckily, in a federally qualified health system, we can bill for therapy in a home. But at the place I worked before, many years, I've been with SIU 8 years. Before that, we couldn't get paid to go into someone's home. And I thought that was such a stark problem that I can't sit in someone's house while their baby is rocked on their lap and provide them with evidence-based therapy. But I could get them that service if they came into my nice office that you see with their baby crying, and then we can get paid. So just little things like that really drive me crazy. Yeah, I think the biggest gap is that we don't go after people who need it the most.
Thanks, Dr. Golden. I know you brought up a huge issue, which is funding sources. And Dr. Yarnell, you've had a lot of experience in working with grants and other funding. Can you tell us a little bit about the various funding sources that you found or wish you could find?
Yeah, we do have some federal programs, and fortunately we're very fortunate to have local partners who fund programs too. So Dr. Golden alluded to some of our neighborhood-specific programs. One of the programs was originally called our Enos Park Initiative. It's now called our Access to Health Program. Enos Park is an area in Springfield, Illinois, that sits between our two hospitals. We have two major medical centers here in Springfield, and Enos Park sits in between those two. And that area had significant barriers to appropriate health care. They could go to the emergency department all they wanted because it was literally within walking distance, both emergency departments. But that's not the appropriate place to manage your diabetes or to treat your stomach ache or whatever it is. And so community health workers were deployed to that area a number of years ago and connected individuals in that neighborhood with primary care. And so we're fortunate to have funders such as the two hospitals to work on programs such as access to care. And then we have our United Way program. And then we've got some federal grants. We have grants through SAMHSA. We've got grants at our state level through the Department of Public Health and a couple grants through IEMA, the Illinois Emergency Management Association, that looks at mitigation of radon within public schools and housing for underprivileged neighborhoods. And so those have been very successful. To Dr. Golden's point, if we had reimbursement type funding for the work that we do, we would be far more sustainable. And so we're pushing that hard with legislation because we would like to have the work that Chantel and the work that Areli do on a daily basis be reimbursable. It's so important, and that way we wouldn't have to necessarily rely on grants and contracts and federal and state and local funding. We would be able to provide these services and be reimbursed for the work that they're doing. So that's my wish. My wish is that we could have our services be covered through insurance providers.
Absolutely, absolutely. And really, just for Dr. Golden and Dr. Yarnell, what advice do you have for other managers and administrators trying to navigate community health work?
Yeah, what's important is to find the right people. I think that's where it starts. It's important that we look for people such as Chantel, such as Areli, who care about the communities that they're going to serve. And who have a vested interest. Areli stated it very well that her work is so rewarding because she gets to work with communities who need a lot of help. And so it's important that the people who are going to be doing the work on the ground are vested in that area. I think that's it's easy to say, but not necessarily easy to do. And so that's why it's really important that the work that they're doing really starts with the hiring process. And I don't know if Dr. Golden has anything to add to that.
Yeah, I'm glad you mentioned finding the right people. I think that I love that you said that first, because it's a good reminder for me too. You know, it doesn't really matter what programs we design or what infrastructures we build, without the right people with the right heart, it's going to fall flat. So I think that's really major. If I had a piece of advice for agencies that aren't doing as much community work that want to do more, I would say try, if you have to, you know, if you can't get to this place you want to be at, maybe start here. We started really small. During my time at SIU, we started very small. We started with maybe a small grant here, you know, a small contract there, and then maybe we got another one, and then maybe we were able to use those two smaller grants to justify a larger one. So the example I like to give is we had a program called the Integrated Trauma Treatment Program, or ITTP. I think we had to name it to apply for the funding. It was funny. And it was basically me, a community health worker / counselor, and a physician working together to serve members of drug court. And they would pay us to do the therapy and some of the case management. They gave us some money for art supplies for groups, and it was just 3 people. It was really just 2 funded people, and we did it for about 2 years. And fast forward to now, we have the Survivor Recovery Center, which is over $1 million a year from Victims of Crime Act funding. So the Survivor Recovery Center is a staff of about 10 people total. We have 4 clinicians, a couple administrators, a psychiatrist part-time. So the Survivor Recovery Center is what we were hoping for, to have a clinic that's a free clinic, standalone, where we can provide services for survivors of crime. But we didn't get hung up on not having that. We just started with 1 or 2 people, and it was not much money. It barely covered my salary. It was not profit at all. Like, we couldn't do anything extra. It was just the time. But I think if you just start small and start, like Dr. Yarnell said, with 1 agency or 1 contract, and start to build your reputation and your skill set, then what we have found is that it builds over time.
Absolutely. Thanks, guys. Now, luckily here at SIU, we're an educational facility. So we really work on research and just collaboration between all the different professionals. Dr. Irizarry, can you talk a little bit about how research and academic professionals do collaborate and these type of practice-based research projects?
I'll try. So there are a number of different ways. My personal favorite is probably through service learning and internship programs, where students who may not necessarily have what they consider to be real world experience are able to get some, right? And we are seeing in the civic engagement literature, I presented on it yesterday, I think, with Michelle Evans, that there is a trend that, you know, civic engagement isn't just like volunteering. Educational institutions seem to be increasingly requiring a type of service learning kind of component for degree programs and graduation requirements. We're seeing professional associations quite frequently either mandate that you need a number of certain of service hours prior to entering the field. And in many ways, in many cases, I should say, the only real way to get that is to get involved, you know, as a student, maybe volunteer, do an internship. And then we're seeing increasingly through alternative, you know, criminal sanctions or punishments that many governments at the local and state level, at least, are allowing individuals to do, you know, a kind of service, we'll call it civic engagement, even though I don't think it's entirely voluntary, in lieu of, you know, potential further criminal punishment. The other thing is I've been noticing, and I'll ask Dr. Nepper if she doesn't mind, you know, to back me up and make sure I'm correct, but I've been noticing an increase in the number of centers and institutes being created on university campuses and on college campuses, and many of them are essentially emphasizing the need for this kind of partnership, this intersectoral partnership, so that students, faculty, community members, you know, private sector businesses, the nonprofit sector, they can come together to work together to solve the wicked problems, right? To help mitigate them. And that, I mean, I would put it under research, but it goes beyond, you know, just the types of research they can come together to create. And in that, you know, in that spirit, I'm going to do a self-promotion plug because I can. So one of our sponsors is the Maurice A. Ferrer Institute for Civic Leadership at Florida International University. The founding director, Dr. Agatha Caraballo, is our conference co-chair, as well as, you know, the founding director. I would say reach out to individuals like her for more details about how the centers can help you address those challenges. The other thing that I think is important as you build those relationships, you know, through centers like that and through faculty like myself, I think it's important to inform us of what challenges you actually have. So we had a panel on foundations in the nonprofit sector, enhancing and fostering, you know, social equity through various funding mechanisms. And the reason we created that panel was because many of them felt that they weren't getting the information until one member finally got it when they took a class with me. And then they were like, oh my God, I didn't know this existed. So we need to, I guess, break the barrier between, you know, the academic institutions and the academics and you guys. And in conversations with many nonprofit leaders, what I'm finding is that they're working like you guys are, but they don't necessarily know what data to collect, or they have a ton of data, but they don't know how to analyze it, right? They don't know how to make sense of it. So there are different ways, and I think that we need to expand our thinking beyond just, you know, writing a paper, you know, publish. No, we need to go beyond that. I'll leave it at that. I hope I answered your question.
Absolutely. How do you think these reciprocal learning communities, how can they be developed and then move projects forward so we can all learn from each other?
The easy way, I think, is to ask, right? I think that I try to bring in guest speakers into my classrooms all the time. I try to get my students involved in outside activities on campus, you know, outside of the classroom, on campus and in the community directly all the time. Every semester, I give my students extra credit if they attend some professional development activity. I put it in the syllabus. All I need is advance notice. I start with conferences like this, the events that I'm familiar with that I can, you know, vouch for, but I also allow them to inform me of what's happening in the community. If they give me enough advance notice, I'll look into it and then make that available to the rest of the students. Again, I think that a part of it could be that we don't have the information, or it's because of information overload that we probably got it but didn't see it. So we forget that the opportunity kind of exists. So I think the first thing is ask. If you're working on a project or you need volunteers, reach out to your, you know, public administration, nonprofit studies, human service programs. Many of those students might need the service hours. Many of those faculty might have answers to some of your questions. And I think that those programs, the faculty and the community members there might be able to connect you beyond what your current network would allow. So I say ask.
Absolutely. So we talked to Dr. Irizarry a little bit about how we can collaborate, talked a little about how we can share that data and continue, and then what we can do to move forward. Can you tell me a little bit what you've noticed? What do you need from this academic research that's going on? Or what do you need that academic research to do for you to move forward?
Me or someone else?
Let's talk about just Dr. Irizarry.
Me, I want to say I don't need any more research, right? My eyes are tired, but that's not true. I think that what I want ties into the conversations we had earlier with Congresswoman Frederica Wilson speaking, with Dr. Fanice Miller speaking earlier, right? We want to solve problems. We need action now. Research only goes but so far, and it takes forever for it to go from, you know, conceptualization to submission and then to eventual publishing. So by the time it comes out, it's outdated at best, right? So we need those partnerships. Yes, we can produce the knowledge base together, I think, right? I'm not saying don't focus on the research, it is important. But we can also work together in other ways, establish those relationships so that we can start doing something about the problems today. And I think that, you know, this panel is a start. If you don't mind me sharing, this happened accidentally in many ways. You know, in doing outreach and talking to people about the conference and trying to fill gaps, right? The goal of this conference was to expand the voices, right? This conference shouldn't be an ivory tower, as much of academia, you know, seems to be characterized as. We want more voices. We want to be as inclusive as possible. We want as many diverse perspectives as possible, because it's the only way we're going to learn about the issues that are pressing today and collaborate to address them. So this panel happened by accident, in the sense that I was speaking to someone about something completely different. They shared it with someone else who worked in their department just to let them know what was going on. And then that person sends me an email saying, "Did you hear about this great work?" And I think it started with the 211 program that SIU had started. That led to a conversation. I hear about it. I was impressed. I was amazed. I was filled with hope. And I'm like, I need to talk to you. We set up the conversations, and here we are today.
Thank you so much. This has been such an amazing panel discussion. I know there's so many people that have questions for us too. My final thing for everyone before we move on to the Q&A, can any of you share a story or anything that really shows your passion for this field? I know Dr. Golden has plenty of these, but anybody else have that as well?
I'm going to go last because I've spoken a lot at the conference.
Sure thing. Dr. Golden, you want to start us off?
Sure. I was just looking up something that Bonnie and I found, and we love it. Bonnie is a close friend of mine, by the way, and a colleague, just full disclosure. We were talking about, because the conferences are such a limited time to speak, we want to highlight, you know, the best things we can. And one of those really great quotes for me is, "We need to stop just pulling people out of the river. We need to go upstream and find out why they're falling in." And that's Desmond Tutu. I really think that's how I fell into trauma work. I was, when I started off my career at SIU, I wanted to specialize and focus on what the need was. What's needed that's not being done? What's no one else doing? And I started looking at my patient panel and kind of analyzing my work, and I realized which patients who am I failing? I'm failing women especially, but men as well. But I was failing a lot of women in their 20s with children who had sexual and physical abuse histories, and especially who were impoverished. They were getting the least out of the traditional talk therapies that I've been trained in, cognitive behavioral treatments and just basic stuff. So fast forward, I've been able to get certifications. I've been able to learn so much more about therapy. And now I feel like I'm capable of working with those women. And now those women are getting better. So when I think about this quote, instead of blaming the women, oh, maybe they're just the people on my panel that are unmotivated. Maybe they just don't appreciate my time. Maybe they're just not responding to the wonder of my personality. That would have been the wrong approach and the wrong viewpoint. And I think sometimes we do that. Up the river, what was wrong is that we have pervasive trauma in our communities, and building programming around them. And I will say too, since we have 2 community health workers here, a few of those women got brought to their appointments by their caseworker. A few women had a community health worker who, one of them I remember, would have likely lost her children to DCFS if she didn't have a CHW getting her housing. So it's everything we're talking about today is so connected, but I guess that would be my story. Long-winded.
Amazing. Thank you. Anyone else, a story that really shows your passion for this? We all know how passionate you all are. You show up every day. You come here on a Friday afternoon to spend it with us. Someone else, tell me what really shows your passion.
So I can go ahead and share. Throughout this year, the academic year actually, I have been working with alternative high school girls which usually are written off as like troubled students, you know, not going anywhere in life, things of that nature. And working with these girls throughout the entire school year, it was very rewarding for me to be able to expose them to different things that they've never been exposed to. For example, many of these students have lived in Springfield and have never visited the Illinois State Museum. So being able to give them those opportunities was really just amazing. And at the end, to wrap up the program, I interviewed a few of these students in groups or individually, and a lot of them did share about how, you know, like, for example, I had one of the therapists from the Survivor Recovery Center come in and speak to these students. And it was something that was very informal, but something that was very, very impactful for these students. A lot of them mentioned that in their interviews, like, I've never, you know, had a conversation with a therapist. I've never been exposed to these things. And so to know that I was part of that and that I was there to help them. And also, a lot of these students don't have mentors. They don't have people that they can rely on, and coming to school can be a struggle because they're just not motivated to come to school. They don't see a point in it. But a lot of them, like, talked about how now I feel motivated to come to school. Like, I want to come to school, specifically even on Wednesdays, because that was the days that we met. A lot of them would be like, I look forward to coming in on Wednesdays. And so just to know that, you know, community health work also, you know, is not only like in the community with individuals, but also in schools. And, you know, there's parent educators in schools as well and things of that nature. But just being able to know that I truly impacted these students was something that was really, like, that I don't take lightly. It was something that was very special to me.
Mm-hmm. And it sounds like you could have easily just given up, put in half the work, and they saw how dedicated you were to finding out why they were falling in. You went upstream to check on them, like Meghan had said. Awesome.
Right. Yeah.
Anyone else?
You know, one of my favorite stories from one of our programs is related to one of our mental health programs. And at the beginning of the program, when a woman enrolled, and we said, well, what's your motivation to get better? And she said, I want to talk to my son. She hadn't spoken to her son in years because she was so involved in her illness that her son had said, you know, if you're not going to manage your mental health, I can't be part of it. I can't expose you to my children and my wife. And so she got better, and we connected her with her son, who she hadn't talked to in 5 or 7 years, who lives out of state, and now they communicate on a regular basis. And she is doing really well with her mental health. And so I thought that was one of the most rewarding stories that I've heard in a long time that came out of one of our programs. So again, you know, when you ask people what their why is, it's those types of stories that motivate people.
Absolutely. All right, Dr. Irizarry, you said you wanted to go last, so we're letting you go last before we take the audience.
Thank you for recognizing that. Normally, that's when people call me first. So I don't have a singular story that would necessarily show how passionate I am about this, but I think that the trend or the pattern is that I want to break the cycle. I don't want individuals to suffer the way that I did. And I just, in general, don't want individuals to suffer if we can do something to stop that suffering. And so I'll share this. I actually gave a lecture on it in a class for the Ferrer Institute and in a class at University of San Francisco School of Management. And the lecture was titled How the Nonprofit Sector Saved My Life. I grew up in foster care, and for the 3rd time in foster care, I went back in when I was 9 and I aged out at 21. I was one of those individuals, although not a woman, like Areli was working with, that dropped out of high school because of life challenges, because the foster care system kept moving me around. I failed an entire semester, not because I couldn't, you know, do the work, but I couldn't travel 3 hours to get to class by 8 o'clock in the morning. And then what's the point of making it to class to just go for the last 2 classes, you know, in the day? I took the next semester off, I dropped out, and because of individuals, I think it was, as Bonnie noted, who decided to go upstream. Someone noticed that the challenges I was facing was what was keeping me from succeeding and excelling. And I was presented with other options. So here I am today, 2 master's degrees, a PhD, and assistant professor, and working with all of you guys. So it's the stories, you know, myself, but also the stories I hear from all of you on the front lines that make me passionate about this, because it inspires me every day. So long as you help one individual, there's hope. And I want to do my best to give that hope voice. And that means giving you guys voice, creating the platforms so that you can share this information. And I don't remember if it was Bonnie or Meghan who pointed out that they wanted to share the good stories, but I also want to hear the bad ones, right? I want to learn from them so that I could find a way to make sure it doesn't happen again, right? We're hearing now about many atrocities like these mass shootings. And I remember a tweet from President Biden, and I think he just said enough. And that's my perspective these days about human suffering. Enough. We have the tools at our disposal. If we work together to address most of them, so we should. And I dedicate myself to creating the platform so that we can do that effectively. I hope that answers your question.
Absolutely. Thank you so much. I want to make sure we give Chantel a chance if she wants to share. I know she shared a lot of stories in the beginning. She was our first speaker and guinea pig. So if there's any other story really that shows the passion for the field, please share, Chantel, and then we'll go to Q&A.
Well, it's like a collaborative thing, because for the past year, after coming off a pandemic, I went from working at home kind of to working in the field with a lot of women that were a homeless shelter, women that were living in a homeless shelter. A lot of them were housed. Not a lot of them, I would say about maybe 15% of them that wanted to be housed, they got housed. Some of the ladies there kind of like are on a repeat cycle, but you know, nonetheless, I would always worry, where are they? Are they coming back? I hope I see them somewhere again in the street. I don't want them to think that, you know, that they're a lost cause or that we've given up on them or anything like that. So those type of things that try to help me build a rapport, you know, that they were staying there, but like I said, I will always see them again somewhere here in Springfield, whether they've been housed, whether they haven't, or I can always ask them, you know, like when we meet, like we had a couple goals set, you know, how are you going with those goals? Even if they did leave the shelter, even if they didn't get housed, you know, trying to keep up with some of them, you know, continuing to be their community health worker since they've been housed has been so rewarding, because they thank me a lot on, you know, helping them get to appointments, helping them fill out paperwork. Helping them understand the process, helping them understand the housing process, you know, encouraging them to please be patient, you know, don't give up just yet. You know what I mean? There is a light at the end of the tunnel. It may not seem like that right now, but when you're in a situation where you're already been kind of beaten down by life, you know, and then you don't want to hear somebody, well, you know, I'm ready to move. I want my own place, you know, so those are the things that would kind of encourage me to keep trying to encourage them that, you know, you don't want to be in this situation forever. This can truly just be temporary, and that there is a permanent place for you.
Wonderful to point out just how temporary everything is, and it doesn't have to stay that way. Thank you so much.
Bonnie, can I say one quick thing before we do Q&A?
Past your turn, but okay.
I know. I swear there was a few things I wanted to make sure I said, and one of them is really important and I forgot about it in the middle section. I wanted to, in the advice section where we were going to give advice as administrators, one of the early things that Dr. Yarnell did that showed me this is like such the right person for the role, and this is such a huge thing that I didn't want to get unnoticed. One of the first things he accomplished from my perspective was he changed all of the community health workers positions to better match their skill level and education, and he got them all more money. And that had been something that had been unsuccessfully attempted in the past, and he did it pretty quickly. And if there are any administrators here, or if there are people that are looking at doing these programs, my biggest advice is honor your staff. They're just as important in their lifestyle, and their needs are just as important as our physicians that work at the medical school. And I just didn't want that to not get said, and I should have said it when the appropriate question was asked earlier.
Awesome. Thanks so much. And thanks, Dr. Yarnell. We don't give enough money in social service. We always appreciate that support. I know we are all waiting to ask some questions. You're more than welcome to just blurt it out, or we also have, I'll keep an eye on the chat box as well. I know two that just came in, just talking to Dr. Irizarry, saying such an amazing success despite systemic structural barriers you faced. And then also another saying, thank you for all you do, Dr. Irizarry. We definitely appreciate that and allowing us to help today. So please ask your questions. We have such a great panel and so much information here we would love to share. So go for it as soon as you're ready.
I'll just, I think more of a comment, maybe some discussion. I started out as a practitioner, so when I was working more in the foster care side of things in the administrative level, did some domestic violence work. And I have to say that once I started collecting my children in my own home, I really rethought what I wanted to do. And I just was, it was overwhelming to constantly be fighting the same battles, and pick up from one community and go to the next, and you're fighting the same battles. And I think that as a society, what is our opportunity to really globally rethink how we're doing business? And we've tried different things, you know, community-based schools, having things co-located in easy places for folks. But to your point, you know, you get people who are really passionate about this work, and how do we, you know, keep our folks. I went back to school as a working parent to get my PhD to teach other people to fight my battles. I mean, I'm honest about that. I wanted to get folks out there and get them motivated to change the world. And that was really fundamentally what my interests were. So, but my question is, you know, just the structural challenges, something as ludicrous as documenting every 15 minutes of your time so you're getting the reimbursement in correctly. I think this is just so crazy making, and we have this at every step of the way, and trying to improve the support and wraparound services for our families. And, you know, I have 3 kids because of, I think, failures of society to properly support their original parents through some of their challenges in life. So how are we going to be able to make widespread improvements in this, I guess, is my question, because it's, you know, we have these wonderful examples that are on this panel, and we just need that globally, right? That's all we need. We just need to ramp it up. And to your point, pay people a living wage, a really decent living wage. So thank you guys. This was wonderful. I just wanted to say I really appreciate this. Is a passion of mine.
Bonnie, do you mind if I comment quickly before the next question?
Go for it.
Thank you. So, I mean, Dr. Knepper is spot on, and I think an initial answer to her is we keep trying. We keep trying new things, right? We support one another and hold one another accountable for doing the work, but also for being mindful and mindfully recognizing and celebrating the successes that we do have, because change takes time and effort. And if we don't do that, we will burn out, right? We will get demotivated. We may, you know, leave and do something else, but those individuals who are suffering will just continue to suffer. And I imagine that's the reason why most of us keep doing what we're doing, to avoid that. So we need to support each other and hold one another accountable. And we can start here on this panel.
I like that, hold each other up as well as hold each other accountable, Jose. Very nicely said. Yeah, my husband lasted not quite 2 years running a shelter for kids that have been removed from their homes. And it was an untenable situation, because every other weekend you were managing all 3 shelters for the weekend on call. So it was, you know, it's very high burnout, very low pay, and it's more the emotional drain than anything else. So kids cycling in and out, the same kids going back in and back out. So I think that emotional piece is really critical, Jose.
Absolutely. Dr. Knepper, I also spent many years in child welfare. I know Meghan spent some time in child welfare as well, and we just burnt out to a crisp here, and now we're working in a different realm, but it's frustrating, and you lose the energy to go upstream and find out why they're falling in, because you're just pulling them out. Pull 'em
That's
out.
exactly it. That's exactly what you're doing.
Do that. So
I'd like to interject again in case you haven't seen it. Pilar Bonilla put in the chat, yes, she agrees. There is no community without unity. And I think that's spot on.
Absolutely. Thanks, Pilar. All right. Any other comments or questions? We still have a few minutes left.
Well, maybe they're shy or they're typing their questions out. We will save the chat, so I will make sure that everyone gets, an appropriate follow-up if I can. I have everyone's emails, it's conference culture. So I'll try to send a follow-up if necessary. Pilar has a question, so we can go with her.
One thing as a social work student that I feel really isn't addressed is that a lot of social service users, that whole like being underpaid, underappreciated, undervalued, and what does that say that we accept that? What does that say about the communities we serve if we accept that? If we accept to be treated this way? What does that say? Because most of the communities we serve are the ones that need us. And it also kind of like shows that they're undervalued. And so if we don't stand up for ourselves, then we cannot stand up for the communities, the people that we are trying to help.
Absolutely. I hate the quote that we're in it from the outcome and not the income, because I like to pay my bills a lot.
No, we need to pay our bills. No, it's not just like we need to, otherwise we won't be here to help them.
Yeah, that's a great point, Pilar. I appreciate that.
Can I just say the answer is we don't accept it. I don't. And I do everything I can to try to work within the system to change it, but still foster the ability to create effective change. I mean, sometimes, you can't, especially in government, you can't offer more money, but there are other things you can do. When I supervise individuals, I give them a flex schedule. I try to accommodate what their needs are within my realm. If I have pots of money, and again, I can't boost your salary, but I might be able to get you an honorarium or cover a professional development event, or get a grant to do so, right? To acknowledge your work. I'll make sure that you're recognized, get you an award, buy you a cup of coffee, show up at your office just to say hi and give you a hug once in a while. And I'm not that much of a hugger, so you know how important that is. But there are things we can do, and not all of us accept it.
Absolutely.
I had
Absolutely.
one-
Let's take a comment here from Karen saying, everyone deserves a decent wage. Thank you, Karen. I appreciate it. Megan, you're about to say something. I know we have just about a minute and a half left.
I have to say this. I always say this to students because Pilar, is it? So we need you. We need social workers, and we don't want you to be scared off by salary, because you might start off small, but you will, if you do hard work and you put in the time, most of us do find more money. Bonnie and I both make light years more than we did. I started at $11 an hour. So stick with it and find those agencies that will value you, because there are good financial positions for social workers. They are out there. You just got to find them.
Yeah, absolutely. Looks like Samantha Santana said such a great conversation. Thank you, Samantha. And then Dr. Nepper says, society pays for what it values. Preach on. Absolutely. And then Dr. Irizarry, can you share your practices for supporting others? We have 50 seconds, Dr. Irizarry. Talk quickly. We can't hear you though.
I send me an email. You should have my information already, or find me later. I just wrote a book chapter on human resources in the nonprofit sector that highlights many of these practices, and many of them are either free or cost, they don't cost very much. So we don't have time to discuss it now, but I look forward to the extra conversation later.
Absolutely. Thanks again, everyone, for joining us. We love getting to share part of what we do and our passion, and get to meet you all as well. So thank you so much.
Thank you, guys.